I'm not trying to sugarcoat it. Our response times are not what they need to be.
So we told you last night how there are not enough paramedics in Multnomah County to get to your 911 calls fast enough.
And now we're looking at other agencies that really need to improve to alleviate this problem. Elise Haas has been following up on her reporting. So this is something that everyone has to come together on.
Yes, and so when I was talking about last night, the paramedics are saying this just needs a whole overhaul because they really need to work together seamlessly. And so I was mentioning that in my report that providing emergency medical services is complex because it's a patchwork of programs. For instance, the county hires out a private company to call AMR to send you an ambulance, while the city then has its publicly funded role of Portland Fire and Rescue and then the 911 call center. And all of that has to happen seamlessly so that way they can get there in a timely fashion. So today I wanted to tell you more about the dispatch center because it really sets the tone for the entire system.
911, where's your emergency?
When you call 911, they immediately ask you questions.
They are trying to figure out what kind of resources they need to send to the call. Our triage system is not 100% accurate, and so we're not quite to that level of accreditation.
When a 911 dispatch center isn't 100% accurate in triaging calls, it can strain the overall emergency medical system.
We know that sending a great big fire truck with 4 people on it is not super efficient, and I think we need to be efficient and meet people's medical needs.
Portland's Bureau of Emergency Communications says dispatchers are giving an accurate description and priority of the caller's problem 93% of the time. BOEC started trying to work towards accreditation in May of 2021, something Clark County has already completed. Reaching accreditation is a tall order. It requires getting dispatchers highly trained to ask the right questions to triage calls as accurately as possible. They also include post-dispatch instructions, which focus on patient care. Currently, Multnomah County says dispatchers are still incorrectly identifying some serious 911 calls as low priority. It could take 2 to 4 more years for the 911 dispatchers to reach accreditation.
And as the triage gets better, it gives us even more options.
But paramedics are pushing for the 911 call center to reach accreditation as soon as possible.
It's going to need a lot more city resources to actually be invested in getting accredited faster than that time frame.
As a labor shortage is leading to burnout, paramedics want the county and city to implement more healthcare options for less severe 911 calls. For example, Clark County has a nurse navigation line. So if someone calls 911 in Clark County, but it's not a serious emergency, they can offer the caller a cab ride to an urgent care instead.
Everybody doesn't need an ambulance. Everybody doesn't need to go to the ER. And right now the system kind of pushes everybody that direction because that's pretty much all we have to work with within our ambulance system.
In an effort to improve emergency medical services, Multnomah County currently has 2 pilot programs underway. The first pilot allows an ambulance with 2 EMTs to transport a patient to the hospital following an assessment by a paramedic. The second pilot program puts non-serious 911 calls in a queue that's monitored by paramedics, optimizing response times for severe medical cases. As far as the timeline goes for accreditation for the dispatch center, the city points out that less than 10% of the agencies who use these protocols are accredited. So it is not something that's easy to get. Well, the city says that 911 dispatch center has a robust quality assurance program and is currently working with partner agencies toward that accreditation.
Yeah, that cab idea is a pretty great one. Yeah. I mean, and that way they're not paying an ambulance bill either. Those people, if it's less serious, if it's a less serious case.
Exactly. And so there are some ways that we can do that now. But again, all of the agencies, the city and the county have to work together. So people can read more about why that's not really happening here in my article at coin.com.
Elise, thank you. Good reporting.
Well, hundreds of Oregon nurses